Hello and welcome to this episode of Health and You. I am Sumi Sukanya Datta and we will discuss the rise of ultra processed food in India, its health implications, and why there may be a need to curb its consumption. This is especially important since the Economic Survey Report 2024-25, which was presented by the government, has also noted this worrying trend and suggested various measures to curb it. For the discussion, we have two eminent guests, Dr. Arun Gupta and Dr. Monica Arora. Dr. Gupta is
Hello.
Convener Nutrition Advocacy for Public Interest or NAPI, and Dr. Arora is Vice President Research and Health Promotion at Public Health Foundation of India. Welcome to the show, Dr. Arora and Dr. Gupta. We
Thank
really
you for
appreciate
having me.
you could take out time for this. So, Dr. Gupta, can you first start by telling us what do you feel about the rising consumption of ultra processed food and what it means for the health and the society? Dr. Gupta.
Yeah, this is no, surprise now at the point that this has been noted since 10 years, that
Mm-hmm.
is a serious rise which is affecting the health of the populations, not only in India but all over the world. And the recent studies done by WHO in India, and specifically, has clearly shown that there is about a 13.3% in cumulative annual growth of consumption of ultra processed foods.
Mm-hmm.
You know, the the surprising part of this is that is why it's being neglected in terms of why we don't have a definition, as the economic survey pointed out clearly that there should be a definition of this must be officially adopted. And we have been taken this up with the FSSAI for many years, and FSSAI has so far not been able to construct a definition of what is ultra processed food means for India. Thankfully, NIN did. So NIN did come up with a
For the
guideline.
benefit of our viewers, we'll tell that NIN stands for National
National
Institute of
Institute of Nutrition of
Nutrition.
Government of
Yes.
India
Yeah.
has come out with the dietary guidelines for Indians, in which it has clearly defined what are ultra processed foods. And these are almost always high in sugar, salt, or fat, and contain a lot of chemical additives which are not needed by human body, like
Mm-hmm.
stabilizers, emulsifiers, or colors, or flavors, or they are all there to increase the palatability and shelf life, so they make you eat more. They are kind of an addictive in nature.
Mm-hmm.
So the rising consumption has an implication of the human body. In terms of the first effect comes in terms of obesity, like overweight. The people start eating more. One of the very important research conducted in the United States Institute of Health was that in 14 days adults actually gained about average of 900 grams, when they are consuming ultra processed food versus unprocessed or minimally processed foods. So and then the group was reversed also, and they lost it also. So the point is that we continue to allow this consumption to go up.
Mm-hmm.
So that's the whole point. And the link to now the several links to mental health, links to chronic diseases. I mean, you name it, and the link is available in the research papers.
Yeah.
1,400 papers have been published in last 3 years on the risks related to ultra processed foods from globe all over the world. Unfortunately, we haven't yet done any research of this nature in India, that how it is affecting Indian population as vis-a-vis their health or their cardiovascular status. And since the cardiovascular status, including the metabolic health, also including cancers, is rising. So there are mentions about it in the press, in the government documentation, the parliamentary speeches. But unfortunate part is that it's not getting across into a regulatory approach, which the economic survey has very strongly recommended. They, they have recommended for everything deregulation, right? But for ultra processed food they have recommended a regulation, and that too a strong and stringent one. Yeah.
Yeah, that's a very important points there, Dr. Gupta. Dr. Monica Arora, you have been working in the field of NCDs or non-communicable diseases for a long time. So there is enough evidence, like Dr. Gupta was pointing out, that it's linked with various kind of, you name any disease and it's linked with ultra-processed food. Yet people consume it so freely. What do you think, are the contributory factors?
Yeah. So, despite this overwhelming evidence linking ultra processed food consumption to non communicable diseases like obesity, diabetes, cardiovascular disease, the drivers which are influencing its consumption are multifold. It is global and local factors. Obviously, globalization of the food industry, aggressive marketing, which has been studied in Indian context, particularly studies by Public Health Foundation of India, very clearly pointing how the ultra processed food is being aggressively marketed to children, and
Hmm.
economic accessibility are major contributors. Also, we have to see that ultra processed foods are often cheaper, more convenient, more widely available than fresh and nutritious food. And also, these studies have shown that 30 to 50% of daily caloric intake in high income countries and now even in India is due to ultra processed foods. So, this is rapidly catching up in countries like India. India nearly has about 19% of urban population is consuming ultra processed food regularly, with consumption increasing among the higher income groups and youth. So this marketing, which is to children, is to make them have a behavior very early in life so that they become lifelong consumers of those products.
Yeah. Dr. Arora, you very rightly pointed out, you pointed out at the marketing part of it. So ultra processed food, particularly the big brands, the big food houses which are there, are aggressively, we see that they aggressively market these products. Often celebrities are roped in for endorsement. They're targeted at children, most importantly. Dr. Gupta has been a very vocal proponent of why it should not be done. Dr. Gupta, would you like to talk about and also mention about the FSSAI's role, because we have
Mm.
laws at the
Yeah.
moment which sort of discourage this sort of practice, but this happens despite of these laws and norms that we have. Yeah, Dr.
Yeah, you are
Gupta.
very right that we have four regulations in this country. Which one is
Mhm.
FSSAI say there should be no misleading advertisement. Now, these adjectives actually keep the regulation away from the people and they favor industry. Similarly, however, the Consumer Protection Act gave a definition of misleading, that any product or a service which does not reveal or conceals important information from it, it will be called misleading. Now, for a food product, the information pertains to sodium or sugar or saturated fat, which is an accepted norm that these are nutrients of concern. FSSAI says there is no regulation which says that the advertisement should tell us that this product contains so much sugar, so much fat, so much. So we have tried every method to complain to FSSAI and Consumer Protection Authority, but we haven't seen any fine, even a fine so far. What to talk of stopping those advertisements? So laws are weak. Then we also looked into the two legislations of what one is pertaining to the print media, which is norms for journalistic conduct. It does
Mhm.
not contain any reference to high sugar foods or ultra processed foods. So that amendment is required, and that's where the role of the government comes. That quickly we have been following up without any response. That if this HFSS or ultra processed food and or both are included as a part of this by some degree of some definition of what is HFSS, so that they are banned for advertisement in the print media.
Yeah.
In the electronic media, there is a advertising code. Now it is handed over to ASCI, which is a industry body. So the self-regulation, again, economic survey has very well written that there is no reason to have a self-regulation on the ultra processed food products. But here we rely on ASCAI, we pay them also, but they have not done anything last 30 years which will protect Indian citizens, but they protect industry. And that law also has a problem. Now, the ministry says that this law contains a clause that any advertisement which affects the safety of children would be not allowed. But all the advertisements are, even now, advertisements with endorsements of celebrities are comparing this food to a work of art also. So this is actually, this whole marketing actually is a threat to our culture, the food culture, the Indian food culture, centuries old food culture, as well as our health. So
Yeah.
if government doesn't do regulations, clearly worded regulations, to my mind, they are going away from the mandate it has. Now, FSSAI, let me share with you, sitting on a regulation for front of the pack labeling, which is another part of the marketing. So the
Yeah.
claims in the front of the pack. So most of the
It's
foods
been
are,
going on for last 3 4 years. If I'm
yeah,
not mistaken, and then they are not coming out with
the
the
final,
front of the pack.
yeah, even on September 22, there was a regulation which was a draft notification. The HS, the health star rating was adopted. Whole world has gone against HSR. Only one country runs it, and that I don't know how FSSAI is so clinging to it and not coming up with anything after 2 years, and they can't study 14,000 comments given by people in 2.5 years now. So what is going on? I think it's everything is benefiting food industry and
Yeah.
taxing our health
Yeah.
and
So one
and
point I would like to mention here is there is also probably a lot of conflict of interest because we see whenever there are norms or these kind of laws discussed by the FSSAI, the industry bodies, industry heads are invited regularly, but there is hardly any representation from the consumer or public health, public nutrition side, right? So this is also a big problem with the way the regulator has been working. And Dr. Arora, now would you like to answer my question, which is about the policy measures that you would like to see probably in order to curb the rise of unhealthy diets and also high food, high fat, high sugar, high salt food items which we see in the market?
So, as I had said, we need a multi pronged policy approach, which is requiring response from multi sectoral departments. So, marketing plays a very important role here because they create what we call as health halos. Low
Mhm.
fat or sugar free claims, these mislead the consumers into believing they are healthier options. There is lack of food literacy and limited awareness of the health risk which are associated with these foods. So very clearly we need to work on those aspects of policy as well as bringing the community along with us on these policy measures. Studies again in India have shown that only 1 in 5 individuals could actually correctly identify processed food as a major contributor to non communicable diseases. So, urbanization, changing lifestyles, increased income, having less time for traditional cooking, all of these are contributing. But at the same time, when we talk about the policy measures, regulating advertising is very, very important. Singapore has a very clear policy that there will be no food advertising in children's channels.
Mhm.
Why that kind of policy cannot be imposed in India when we are concerned about our young population who will be our future of the country. The message is very clear. What we eat today will shape India's health tomorrow. And we
Mhm.
are feeding our younger population with very unhealthy diets with these ultra processed foods. They will end up impacting the productivity of the country because they will have non communicable diseases very early in life. And these economic pressures and marketing influences, coupled with lack of awareness, urbanization, is creating a very enabling environment for ultra processed food to thrive. despite the evidence of their harmful impact. So, a multi pronged public health strategy requires better regulation of food advertising to improve food literacy, promoting policies that support access to healthier food options. And only when we begin to curb the growing tide of NCDs, then only we will be able to change behaviors. And this requires changing behaviors in the school settings, in the community settings, in the workplace settings, and that can happen only with enabling policies. Schools are serving in their canteens very unhealthy food items which are ultra
Absolutely.
processed, and we can very easily change. That is something which is under the regulation of the school authorities. It just requires co-creating healthier menus, and we have tested some of those models where students have been involved in creating healthy menus for their canteen. They themselves choose to have healthy food options. So when we create that kind of enabling environment in school settings, we will ensure that the policy of the government, CBSE, says no sale of junk food inside and outside the school. But we very clearly see none of these policies are being followed either in schools or in colleges, whereas UGC also has these guidelines of no sale of unhealthy food in and around the school. But
Yeah.
again, studies have very clearly shown that this is being very widely violated, with only unhealthy food items available in their surroundings. So they don't have a choice but to consume these items which are easily accessible to them. So
Yeah.
just to conclude this segment, to say that we need a very committed government program on controlling overweight obesity, whereas currently all the program and the focus of the government, even through Poshan Abhiyan, is on addressing undernutrition in India. But we need to understand, we need to act on both ends of the spectrum. Let's work on it as malnutrition, having one end of the spectrum as undernutrition and the other end having overnutrition, which needs to be curbed comprehensively.
Yeah, very important points there, but probably like Dr. Gupta was pointing out, we don't yet have a clear definition of ultra processed or unhealthy food. That is also one problem. Also, some months back, we saw a big controversy when there was an international report saying that Nestle, which sells its baby food in so many countries, gives more sugar in the baby food product, which goes by the name of Cerelac in India, whereas the sugar content is lesser in developed countries. Now, FSSAI's standard answer when you go to them is that we follow the international codex and they comply to our regulation. What do you think, Dr. Gupta, is the problem here, and how these practices by food companies, the giant food companies, can be stopped?
No, unless the regulator behaves like a regulator, it won't solve the problem. The this whole thing with masalas and then this controversies keep on arising because of the weak system of regulations. We don't act as regulators. That's the I think the major problem here, and in terms of whether it's a sugar content or labeling, as I said earlier. So the important point here is that who else who else will act, right? So if the
Mhm.
ministries, the governments have the mandate to do a regulatory approach to these companies, the companies are not going to oblige you. We should be clear on that. So if there is a proposal that be friendly with them, be partner with them, this whole stakeholder approach, to my mind, is a misnomer of misleading people. In terms of when you call stakeholder meetings, all the industry comes up there, so you don't get a good policy. So how can you do it? The intent has to change at the regulatory desk, and the intent has to be clear that I want to reduce the consumption of, as you started this show. So if you lose that objective, if you only doing okay, thoda chini kam khao, thoda namak kam khao, this doesn't help people. You have to have these clear cut regulations matched by the campaigns of what are the risks. The economic survey has put it was very nicely. the
Yeah.
clear communication in the economic survey that there should be a campaign to tell people the risks of ultra processed food. While we do not tell any risks in our campaign, we only say so. And there is a line there, it say don't focus on the single nutrients, but we keep on doing that. Somebody is saying salt kam kariye, somebody is saying oil kam kar dijiye, somebody is saying चीनी कम कर दीजिए. सबको पता है, ऐसा तो सबको पता है, बट ये नहीं कोई कहता कि इंडस्ट्री का एडवर्टाइजमेंट को बंद कर दीजिए. So if we can have three important regulations, one is this front of pack warning label. If that warning of high sugar, high fat, that's this product. So immediately people will be aware till the advertisements are stopped. But you go to buy something, if it contains a label saying this is high sugar, I'll decide whether I want to buy. It is very helpful for diabetics, hypertensives, those who are already suffering also, that they can contain their sugar or salt or fat intake. Then, second is the ban on advertisements. Children are exposed to every advertisement at home. So, this children's channels also are. So, I would say if you have to take a case, I think PHFI paper also mentioned, and some UK people have also argued about it. So, ban it from during the daytime till 10 o'clock at night, and then you run those advertisements if at all. But I would, if I had the power, I'll ban all the advertisements which are more than 10 for 10% sugar, 10% fat, and 250 milligram of sodium. If the food product is more than that, advertisement should be stopped. So we are not asking that companies cannot do it. So चीनी डाले बिना तो आइसक्रीम नहीं बनेगा, right? We are not asking you put less sugar and put aspartame in your. It's your choice. The industry does it the way it does. Let them produce what they produce, but the government's job is to regulate high sugar, high fat, and high sodium products, ban it from advertisement, and this same parameter can be used to tax them for a higher
Mhm.
level of GST. So these
Yeah.
three things have been shown in the world to reduce the consumption in Chile, in Mexico, in
Yeah,
several other
probably one
countries.
way, like Dr. Arora was also saying, is to make them more less affordable and less accessible. Probably that's also a way of going about it. So let's hope that the government listens to what it itself is saying and rectifies the problem that it itself has identified.
and, and use the tax money for subsidizing the healthy food.
Absolutely,
Don't
absolutely.
put it somewhere else. If you get the tax out of unhealthy food, it must be subsidizing healthy food.
Yeah.
That's the only way to actually increase the consumption of healthy food.
Very true, very true. With that, we come to the end of this discussion. I really appreciate both of you taking time out for this. Thank you, Dr. Arora and Dr. Gupta. Thank you.
Thanks a lot.